Successful instrumentation technique depends to a great degree on the precise placement of each finger in the modified pen grasp. The thumb and index finger hold the handle of the periodontal instrument in a relaxed manner. It is important not to grasp the handle tightly. If your fingers are blanched, you are holding too tightly. The finger pads of the thumb and index finger are opposite each other at or near the junction of the handle and shank. The index finger and thumb form a soft C shape. An incorrect grasp occurs when the index finger and/or the thumb curves inward toward the instrument handle. This U-shaped grasp causes the finger pads to lift off the handle, making it difficult to move the instrument. The finger pads of the index finger and thumb hold the instrument. The instrument handle rests against the hand somewhere in the blue shaded area. The middle finger rests lightly on the instrument shank. With the middle finger on the shank, the clinician is able to feel vibrations transmitted from the working end to the instrument shank. The middle finger is not used to hold the instrument. You should be able to lift your middle finger off of the shank without dropping the instrument. One side of the pad of the middle finger rests lightly on the shank. The other side of the finger pad of the middle finger rests against, or slightly overlaps, the ring finger. The ring finger supports the hand in the grasp. The fingertip of the dominant hand balances firmly on a tooth to support the hand during instrumentation. When grasping a mouth mirror, the ring finger balances on a tooth or against the patient's lip or cheek. The pad of the ring finger balances firmly on the incisal or occlusal surface of a tooth. The ring finger advances ahead of the other fingers in the grasp. It is held straight and upright to act as a strong support beam for the hand. The little finger has no function in the grasp. It should be held in a relaxed manner near the other fingers.
Holding the probe in the Explorer is done with a relaxed grasp. The instrument rests against the side of the third finger. The thumb and index finger hold the instrument with the pads of the fingers and aligned across each other. A slight tripod of the thumb, index, and third finger is allowed. When the additional pressure is needed to secure the instrument, the index finger is engaged and the knuckle is straightened. For a more relaxed grip, the knuckle of the index finger is relaxed and slightly flexed. The instrument should rest between the knuckle of the index finger and thumb. When accessing the posterior region, the modified pen grasp will need to ride further up the handle, and in some cases will need to fall into the web of the hand to achieve proper adaptation of the blade. This position should not be maintained for any length of time, as it will cause increased flexion of the thumb and bending of the wrist. In practicing the modified pen grasp, hold the handle of the instrument with the pads of the finger and thumb. When held properly, the instrument will feel secure. Never hold the instrument with the tips of the fingers. This will lead to aggressive pinch force trauma that causes carpal tunnel disorders and other musculoskeletal problems. It will also interfere with the tactile sensitivity that must be developed for proper instrumentation. It is important to identify common errors when applying the modified pen grasp. First, be aware of the amount of pressure placed on the instrument handle. The pressure will vary depending on the procedure and instrument. When using explorers and probes, always hold the instrument with extremely light pressure. If blanching of the fingers is evident, the grasp is incorrect. Relax the fingers and adjust your grip. Light pressure is necessary to develop tactile sensitivity with these instruments and to ensure patient comfort is maintained. It is important to note that the handle rarely sits beyond the large knuckle of the index finger. This occurs when the instrument is held with the very tips of the fingers and not with the pads. The imbalance causes the index finger to ride up the handle and out of alignment with the thumb. The instrument will eventually fall into the web of the hand, causing the modified pin grasp to be unstable and the instrumentation to be ineffective. The thumb should not be bent to the point of flexion. Constant tension on the joint will flow through the wrist and lead to musculoskeletal disorders.